And I've also been covering what House Democrats want in terms of an amendment to the first CARES Act, saying that undocumented immigrants were left out because a lot of them have tax ID numbers and they weren't able to get direct payments.
Yeah.
Do you think that CARES Act should be amended so undocumented immigrants can receive them, those payments?
I think every one of the COVID relief measures should be eligible to a tax ID identified person. So if you have a tax ID number, you are a worker, you should be able to obviously get the unemployment insurance. You should be able to get whatever relief packages they are, because they are workers and they are part of our community and they are part of the country, our families, and our fabric. So we want to make sure they are included. And the tax ID number is the quickest, simplest way to do it.
Do you have an estimate of when the economy should start reopening? There's been discussion of different dates being thrown around. So I was wondering what you think when the economy could start reopening piece by piece.
I think it's dependent on where we are with COVID, um, what the rate of infection is, along with what the number of people who are dying from COVID is in terms of the morbidity rate. So there's two rates, rate of infection and morbidity rates, that I think will determine where we are when we are. I also think the absence of testing is a huge problem. We really can't legitimately open up schools and commerce until anybody who wants to be tested can be tested. Because the truth is, we know a certain percentage of COVID patients are asymptomatic. The last estimate was 25% of COVID patients are asymptomatic. The first estimate was 70%. So it's some number between 25 and 70%, and we don't know what that number is. And until you have readily available testing and have it be rapid testing, meaning you could know the answer within 15 minutes, it's going to be very hard to open schools and society in general back up, because there'll be no safeguard that you're safe to go back and that the people around you are safe. So I think testing is required. And the White House has really dropped the ball on testing. They said they were going to use the Defense Production Act to make testing available in all 50 states. They've not done it. One of the news reports I heard today said they've opened up about 6 test centers around the whole country. Obviously, that's inadequate. We need hundreds of thousands of test centers around the country, if not millions. And that's the problem. We just don't have the accessibility. Every pediatrician's office should have it. Every doctor, every health center, every emergency clinic should all have rapid test available.